Hello and welcome. I would like to introduce you today to Jordana Latozas, owner-operator at Recovery Mobile Clinic. Well, Jordana, among other things, has also been an acute care nurse practitioner at Highland Milford Family Clinic. So, Jordana, how are you today?
I'm doing great. Thanks for having me.
Well, it's a pleasure, definitely. So, adding to what I just introduced you to our audience with, would you want to tell them something more about yourself? Like, what have been your key contributions to the industry at large?
Sure. I have been in addiction medicine for the last 6 years, but before that, I started as an ICU nurse and as a nurse practitioner in pain management and interventional pain. So I've been having a passion for this like high risk population for a long time. I even did my master's dissertation in different medications that are used for opiate and alcohol addiction. So this has always been kind of a key point in my personal career choice based on family history and some other kind of exposures that I've had personally as well as professionally. So we were recently just able to take that into action by founding the Recovery Mobile Clinic in 2020 and really taking our dream of increasing access to healthcare to that population.
Well, that's interesting. A lot of information and a lot of knowledge for me as well. So, Jordana, what prompted you to attend our recently concluded health conference?
The conference presented me with a very unique opportunity. One, we were honored to accept the 100 Healthcare Visionary Award. We recognize that mobile clinics are kind of a wave of the future. So it's nice for a mobile clinic to get recognized because our biggest battle with mobile clinics is actually getting recognition as a legitimate healthcare, access point. So we wanted to make sure, not just for us, but for mobile clinics in general, we're getting those recognitions out there. But it also was a fantastic way to just network with some great forward-thinking people. It's fantastic to be in the room when everybody kind of thinks like you. Everybody's thinking out of the box. Everybody's thinking about 10 steps forward. Everybody's pushing for the next innovation. And so it's a very empowering and enlightening experience to be amongst a bunch of mindset like that.
Well, I'm glad that you had that kind of experience at the conference and you were able to actually, meet people in person because if I talk about the COVID times, we have all been stuck for a very long time now and people haven't been able to meet in person, grow their network horizons. So with the conference, I am very, very much glad that you were able to actually, expand the networking and your business scope as well. So Jordana, how would you rate or summarize the experience at the in-person event, especially in times of COVID-19, speaking from the learning as well as networking, experience?
It was done really well. There was a lot of space. There wasn't really times where we felt too close. It was the flow of the conference went really well. The pace of the presentations and everything, not to mention the content, was excellent. So it was very, like I said, it was very enlightening to be there and just fun to kind of listen to some other areas that don't necessarily have anything to do with my field, but it's just very interesting to see where medicine and healthcare in general is kind of taking the future. So the conference was very positive. And like I said, I think everybody felt safe and comfortable in the environment it was set up in.
Of course. I mean, were you able to walk away with any potential deals or contracts?
We didn't sign any contracts, but we did increase some partners. And so we are in communication with them ongoing. So some with some labs and some with some other rehabs, clinics. So again, getting our awareness out there and just kind of the mobile clinic accessibility out there was a huge push.
Well, of course, I'm delighted to hear that. Also, Jordana, were you satisfied with how the team managed the unfortunate postponement of the event in times of COVID? And I mean, I'm sure you're aware that the event was postponed quite a few times because of the pandemic. So, how would you, rate your experience with that, or would you mind sharing your thoughts on the same?
I thought it was good. The communication was pretty thorough. And so we all kind of knew what to expect. So that was kind of the biggest thing is as soon as the questions popped up, we had an answer pretty quick within, the 72 hours. And so that was the main thing. It's just making sure that the communication was thorough, and it was.
Well, thank you so much for the lovely feedback. Lastly, how likely are you to attend our future conferences, and would you be recommending the same to the aspiring as well as, incoming leaders in the global healthcare industry?
Based on our experience that we have, we'd be highly honored to attend future conferences, but also really pushing, other new and upcoming businesses, to do the same, because I do think that this is a worthwhile time.
Well, thank you so much, Jordana. Thank you for gracing our event with your presence. And we very much look forward to having you again with us in next of our in-person events. Until then, I would wish you all the very best with your future endeavors as well. And we were lucky to have you at last.
Thank you so much. You have a great day.
You too.